Hello, everyone. Hi, this is Bob Miglani. I am live. We are live, and we're going to share some really powerful strategies to help you in your clinic convert more. And really, we want to focus today on language in the exam room, language in the ocular surface of evaluation. I've did so many training sessions this past week. I did six training sessions, six training sessions this past week with optometrists focusing largely. They had an IPL, they had an in mode, they had a luminous, they had all different eyelight IPLs. So if you're one of these doctors who are doing dry eyes and you've got an IPL, an RF from these wonderful companies that have this, and you want to know how to get more patients signed up, you've got to change one really important thing. It's the language. The language you use is really powerful. I had one doctor yesterday. She told me she was so overwhelming the patient. The patient left and said, I don't understand anything you said. I need to go home. And that's what the patient said. And the patient left. So this is a real problem. So what we're going to try to do in the next 30 minutes, grab some lunch, grab a sandwich, put this, you don't have to watch the video. If you want to watch the video, please do. But you can just put this on the side, but listen to the audio. It's really going to be helpful to you in growing your dry eye business today. All right, let's get started. All right, so 30 minutes, 40 minutes. I'm going to go into it deep. I'm going to go really deep. Take notes. The video is going to be available to you. If you have questions, raise your hand, okay? And what I'm going to share with you is how the language needs to shift. All right, the first very important thing I'm going to share with you the language to use in getting more conversion and more patients to sign up for your dry eye treatments, the IPLs and RFs and so on. All right, so the first thing to remember, I want to share with you. All right, so number one, don't overwhelm. Don't overwhelm the patient with all of this information about diagnosing the condition, treatment options, private pay in one visit. When we overwhelm, when we confuse, we lose. So many doctors do the following. Patient comes in, they say they have symptoms, and you say to them, oh, you've got dry eye disease. Oh my God, that's amazing. I can't wait to tell you about my dry eye treatments, right? So you go in there and you start explaining. You've got meibomian gland dysfunction. You've got dry eyes. We could try compresses. We could try drops. But you know what's going to be really great for you is this IPL. And by the way, that's $1,600, $400 for treatment. And by the way, it's not covered by insurance. And the patient's like, doc, like, whoa. You can see the patient go like this, whoa. Like you can see it in their eyes. They're like, oh my God, you're completely overwhelming me. And the patient's like, I just came in for an eye exam and glasses, doc. Like, that's all I wanted was glasses and eye exam. You're telling me about something. I can't just use drops. And then you go down this conversation, this rabbit hole of way too much. And the patients leave. And then you say, oh my God, how am I going to pay for my IPL machine because the patients didn't sign up? This IPL isn't working. But that's not it. It's the language you use and what you did and what you said and what you didn't say. It's really important. So now, what's a good situation to do? How to do it better. So point one, don't overwhelm the patient. It's too much information when they don't expect to hear that information, okay? So it's really important. Don't overwhelm. Do the following, okay? Really clear. You have a patient sitting in your chair and they're talking about, they've got symptoms, let's say, and they say, we've got these symptoms. So what you want to say is, look, I suspect you have something called meibomian gland dysfunction, okay? I suspect it, okay? What is MGD? You're like, what is MGD, right? What is MGD? I suspect it's MGD, or some people call it dry eye disease, but it's a little bit deeper. It's not just something that we can cure with just drops or compresses because they don't get to the root of the problem, okay? And I know it's a little overwhelming. You didn't expect that. You just wanted maybe some drops or whatever. You have to say something out loud the patients are thinking about. You're like, yeah, I know you didn't expect to hear this, but here's what's happening. I suspect you have meibomian gland dysfunction. I'd like you to come back for a follow-up visit where we're going to go deeper into what's really going on with your eyes. Yes, I can certainly prescribe you. Yes, suspect. Thank you, Tony. Thank you. Suspect is a great word because you don't know. You really want to do is go deeper. So, Tony, thank you for that wonderful tip. Yes, suspect that you have something called meibomian gland dysfunction, and I'd like you to come back for something called an ocular surface evaluation. Okay, and it's about a week. And look, I know you got a lot going on in your life. I really think it's important to do this. I wouldn't be doing myself, doing a good job as your doctor today if I didn't ask you to come back and dig a little deeper. I don't want to overwhelm you in this conversation today. So let's talk about that. And I want to educate you between now and then. All right. So does that make sense? Yes, doctor. And that's it. Don't complicate the exam. You complicate, you cram the comp, and you will always lose. You've got 18 different things you've got to go through. And so it's really important not to overwhelm the patient at once. Does that make sense, folks? If you hear me, if you like what I'm saying, say yes, give me a thumbs up, and you understand what I'm saying. When you confuse, you lose. So you've got to be clear, crystal clear. I suspect you have this. Thank you, Tony. Thank you. Indeed, leads to the close for the evaluation. Yes, and what I've encountered with my dad and how low vision. Great. Thank you, Tony. Thank you for that wonderful story. I hope your dad is good and the low vision. I'd love to hear your situation as well and understand how you felt as a healthcare professional getting your father treated like that. So I think it's really important. Thank you. What we want to do is close, use the close word. Does this make sense? Does this make sense? Okay, so that leads me to the second point. Very important second point, folks, okay? First one was don't overwhelm. Second, patients need to make sense of why. Why is this happening to me? You're telling me I've got this thing I never heard of before called meibomian gland something, okay? Meibomian gland dysfunction or dry eye disease. I never heard of it. Like, why do I have it? Like, what is the deal? Like, is it just like whatever? It's just like allergies? What is it? So you need to explain. Thank you, Tony. Thank you, wonderful. Thank you, Tony. Wonderful, great chair, side manner, Emory. Wonderful. I'm glad you got a great doctor, Tony. Thank you so much, Tony, for sharing that insight about what you happened at with your father in the low vision clinic. That's wonderful. Emory, great place. There's also a low vision clinic in New York, by the way, as well. A lighthouse, I think it's called. But anyway, let's go back to the core point here. Number 2 was you have to make sense of why something happened to the patient. So if you do meibomiography, let's say you do meibomiography and you find the patient has deterioration of those glands, right? Or even if they have symptoms, right? You've got to explain the why before you get into how you're going to treat it. You can't jump from the problem to the solution without the why this is happening. You've got to explain in a little detail. Patients need to make sense of what you're telling them. If you just tell them you've got meibomian gland dysfunction or dry eye disease, and the solution is my beautiful, shiny $120,000 IPL, they're going to be like, I don't know. Sus is my kid. I suspect you're trying to sell me something. I'm not going to listen anymore. So you need to explain why this is happening. So here's what you do. Here's how you do it. So a real specific tip. Mr. Jones, you're probably wondering, hey, doc, my eyes don't feel dry. How come you're telling me I have meibomian gland dysfunction or dry eye disease? Okay, you have to say that. Say that to the patient. Okay, you've got to be a mind reader. You've got to say to the patient, Mr. Jones, you're probably wondering, powerful phrase, because it brings out that hesitation question. Patients have questions in their head. They hesitate. They're trying to get out of their visit. They're trying to get out as fast as they possibly can, right? So what you're trying to do here is you're trying to bring that hesitation question out onto the table. And the way you bring the hesitation question out onto the table is you say the following. You're probably wondering, doc, my eyes don't feel dry. What's the big deal, right? I don't feel dry. Why are you telling me I have something called dry eye disease? My eyes don't feel dry. And so you must answer to the following. You're right, Mr. Jones. You may not feel symptoms until often it's too late. Just like so much of disease today, we don't feel. Do we feel anything when we have high blood pressure? Not really. Do we feel anything when we have high cholesterol? No, we don't. Diabetes. There's so much of disease today is asymptomatic. But we know that a lot of people we might know walking around feeling fine and they had some sort of heart problem, right? It's because so much of the disease today is internal, is asymptomatic, right? And we can only pick it up in either a blood test or a scan, like an x-ray. And that's what we did today. We did a scan, a meibography of your eyes, and we found something that concerns me. So you're absolutely right. Your eyes might not feel dry, but there's something going on that the scan showed us was wrong. And that is my concern. And so does this make sense, Mr. Jones? Right? And doctor, yes, doctor, it makes sense. Just like dentists, right, doc? Like when you go to you get your x-rays and you see cavities, you've got. So it's the same thing. So that's the words and the phrases you want to use. You want to always start with, hey, you're probably wondering, Mr. Jones, why is this happening to me, right? Or what's happening? Like, how come my eyes don't feel dry? Or explain the why. So another tip. So, we had a doctor explain, to the patient, he said, why this is happening? Well, I started explaining structural damage, right? This is the way the glands work. And it's like, and he's like, no, I just, why is it happening? Like, what's going on? How come 20 years ago this wasn't happening? And so what you must say instead of like explaining the structural problem is go into like, look, screens, right? Right. Thank you, Tony. Good linkage of scan to findings help the patient understand the cause and effect and the close for the absolutely. Tony's 100% right. You've got to use the scan because that's objective clinical assessment. That's an objective clinical assessment. But let's talk about the why this is happening also, right? And then Tony knows this very well, right? Screens, whether our kids who are suffering from nearsighted myopia, which is another whole thing, right? We'll talk about another time. But screens, when we look at screens, Mr. Jones, right? That's a very specific thing. You look at screens, we're not blinking enough. And when we don't blink enough, our glands don't pump that beautiful, healthy oil. And therefore, the glands get clogged. They get clogged. Yes, they get clogged. So because of screens, this happens more and more and more. Hi, Sachin. How are you? Thank you for joining. Hey, Sachin Sharma joined. Sachin, nice to see you, my friend. How are you? I don't know Sachin. Do I know Sachin? Maybe I do. Maybe I don't. But I know you now, Sachin. So thank you for joining, and thank you. And if you have a question, let me know what questions you have. But here's the point, folks. Patients need to understand the why. They've got to make sense of it in their head. And the way you make it make sense to them is explain to them about the screens. It's really important, Mr. Jones, that we understand. You're probably wondering, why is this happening to me? And the way you do that is say, you're probably wondering. And so the answer to that question, Mr. Jones, is that you're on screens too much. Your life has changed. Everywhere we go, we're on screens. We're on screens at work. We're on screens when we go home. Screens in the bathroom. Okay, when you go to bathroom, public restrooms, we hear audio of Instagram videos in the stalls. It's like, dude, everyone's on screens all the time. In my family, we have 3 children. And guess what happens at dinner? Hey, how are you, Vijay? Nice to see you. Thank you. Good logic. I appreciate it. Thank you very much. Yes. So the screens, we're on screens so much. We have 3 children at home. And at dinner, guess what's happening at dinner? Everyone's on their phones. My son is watching YouTube on the TV. My 17-year-old daughter is watching in another room. She's watching on her phone, whatever she's watching. My older daughter is watching on her laptop, and I'm like sitting like an idiot. I'm like, well, what am I gonna do? I pull up my phone. I'm like, I'll watch something. I watch Netflix. I'm watching Suits on Netflix, right? So we're all on our screens, Mr. Jones, more and more. And so what we're seeing is when we're on screens, we're not blinking enough, and therefore the glands are getting clogged. Does this make sense? So it's really important. You have to say, Does this make sense? Because that's a close. You got to have a soft close. It's a medical close, folks. It's does this make sense? Because the mind is a sense making machine. If something's not adding up, people are like, I'm never going to come back to this, doc. I don't know what's going on, right? So this it's just not going to happen. So it's really important that we make sense of it for the patient. And the way we do that is the powerful phrase. You're probably wondering why this is happening. Let me explain. Does this make sense? And then you close. And the doctor says, yes, doc, it makes sense. Great. Well, here's what we're going to do. We're going to have you come back, right, for ocular surface evaluation. So let me pause there. So two things we shared, are very important. Don't overwhelm the patient. Number two, you have to explain why. Why is dry eye disease? Why is meibomian gland dysfunction happening? And that is really, really powerful. So I'm just going to pause for a second to see what a question there is. Sachin, thanks, Bob. I have a question. Does dandruff cause eye pain or itching? I have no idea, Sachin. I have really no idea. Dandruff? I don't know, dude. Like, that's, you know what? You need to consult your healthcare professional for that answer. Okay? I hope that answers your question. Good, interesting question. Interesting question. Does dandruff cause eye pain or itching? I have no idea. You got to go to your doctor. Okay? Talk to your doctor. Talk to your doctor about dandruff and itching. Okay? Mind reader. Yes. All right. So let's go to the third thing. The third thing. Thank you all very much for this amazing conversation we're having today. We're talking about how do you close, how do you convert more patients into dry eye disease treatments that are medically appropriate and necessary. Okay. The third most powerful thing. Okay. You've got to relate your conversation to something that they already know. It's really important. What you want to do is, in terms of a language you use, if you start using words, meibomian gland dysfunction, and not explain to them what it is, right? What glands are, where they are, right? You have glands and what this looks like. They're like, you're isolating yourself, okay? No one likes a know-it-all. No one likes a know-it-all. People today expect their doctor to explain things to them. Otherwise, the doctor's separating themselves from the patient. And so you must do is you must relate something and make them familiar. Like familiarity is very, very important. So let me give you an example. Okay. Just like what I used before, which was Mr. Jones, dry eye disease and meibomian gland dysfunction we catch when we do a scan of your eyelids. You did a lower scan of your eyelids today, and we found your glands were clogged, right? They were clogged. We found them. I know you don't have symptoms, but just like we do blood tests, right? We find things like cholesterol, vitamin D levels, your testosterone levels, all these things, right? We found that we do a blood test. Just like also an X-ray done at your dentist's office, they find, hey, you have gum disease, or you might need a root canal maybe 60 days from now, but something is emerging and you may not feel the pain. So what you've got to do is to explain something that they're already familiar with. They're familiar with dentist offices, right? They're familiar with getting an X-ray. They're familiar with getting a blood test. They're familiar with getting a hip or knee X-ray. So what you want to do is explain and connect that. So, just like your dentist does an X-ray of your teeth, we do a scan, or what we call a meibography, but you call it a scan of your eyelids, and we found something. So it's really important to do that. As another example, second example, right, is when we talk about docs, some patients say, well, doc, why can't I just use drops, right? Why can't I use drops? And so the answer to that, Mr. Jones, again, you have to make it familiar, right? So Mr. Jones, you're right. Drops are can be very effective for managing the symptoms, right? So you put drops in, you feel better, but they're really not getting to the root of the problem, which is your glands are clogged. They're clogged with hardened oil. So you know what I gotta do is I would have to heat your drops to 300 degrees and put them in your eye to maybe get that heat to melt those tubes, those glands that are clogged. And I'm not doing that. People are like, oh yeah, you're right. So you have to do it related to practical things. The other way to do it is say, some patients ask, Mr. Jones, hey doc, why can't I go to drops? Just get drops for this problem if I have it. And you're right, drops can be helpful, but they don't get to the root of the problem, which is really inflammation. And I don't want you to keep going to CVS or Walgreens every other month to pick up drop after drop after drop and spend thousands of dollars over there. And look, it's really hard to get parking at that Walgreens, by the way, right? Like, you have to relate it to something people are familiar with. When you connect your humanness with the patient, and the patient's like, yeah, he is awesome. He explained it to me. It made sense to me. And then we have a solution. But the point of all of this, yes, absolutely, Tony, thank you. Root of the problem. Great way to explain managing symptoms versus treating the issue. The root of the problem is glands are clogged. I can't put drops in and unclog your glands. It's just not going to work. So it's really important that we get to the root and we nip it in the bud before this gets worse and worse. All right, let me back up for a second. Let me kind of, just summarize briefly for you. The reason we're here, folks, is that patients, it's very hard today in any practice, especially in ophthalmology practice, you have to get patients to sign up for specialty treatments like an IPL or RF that you have. A lot of patients have that problem. A lot of patients have the disease, but only a few are signing up. And the primary reason for that is you're overwhelming the patient with too much information in a comprehensive visit. Say fewer things. Say few things. Say less. Say less, as they say. Say less. By the way, I saw this great show called The Bear. If anyone's seen The Bear, raise your hand. Amazing show. And I heard the other day, one of the characters said, say less, say less. So I'll say less. Don't overwhelm the patient. Number two, help them make sense of why this is happening to them. We need them to understand, so that one of the other reasons you need to make them understand why this is happening, because they gotta explain it to their wife when they get home, right? I'm a 55-year-old guy. I take our kids to any doctor. I'm feverishly writing notes, or I'm like looking for content so that I can repeat it to my wife when I get home, because my wife is going to grill me and say, what happened to the dentist today? What did the pediatrician say to our daughter about our daughter? I'm like, I think she said this and the other, honey. Yeah, I got to say it back. So you've got to be really clear and explain the why, so that the patients get a sense of it, that they can explain it back to somebody else. And the third thing, very important, I want to share with you was connect familiarity. Connect what you're saying with something that they're already familiar with. Thank you, Sachin. Great session going. Thank you so much. I appreciate it, Sachin. Thank you for that positive vibe here. So connect it with them. What are the reasons you want to get more patients? Folks, why are we here? Why are we here listening to me? Why are you here listening to me? You're here listening to me because you're interested in growing your optometry practice, your ophthalmology practice, and you want to think about and shift the language that you're using. And so we think it's really powerful when you shift a few key things along the journey. So I want to stop for a moment. I want to open it up. What questions do you have for me? If you have any questions, let me know what questions you have. And I want to see, we have a question here. Yes, we got a question here. How do you convince the patient to come back? How do you ask them to come back for the second visit? All right. So a lot of times, great question. Thank you for that question. How do you get the patient to come back for that second visit? All right. First of all, not everyone's going to come back. We know that. Law of statistics. But second, it's the language you use. And here's the tip. Here's how to do it. All right. Mr. Jones, let me recap what happened today. Your scan showed us there was something wrong, and I'm concerned about it. Your glands are deteriorating. You're on screens a lot. We all are today. And what's happening is we're not blinking enough, and therefore our glands are getting clogged with a hardened oil, because when you don't blink, the glands don't pump that oil, and they deteriorate and they die. And what we've seen is, once they are gone, they're gone forever. Okay. Thank you, Tony. Talk to you later, buddy. Thanks for joining. So the glands are gone. They're gone forever. They're not like starfish. They don't grow back. This is my buddy, Todd Cohen. Dr. Cohen says this. Amazing. He's the GOAT of dry eye disease, Dr. Todd Cohen. Look him up. I'll drop his name in here. He's amazing. He showed me so much. He taught me so much. And one of the things he says is, Mr. Jones, it's not like starfish. They don't grow back. Once the glands are gone, they're gone forever. And once they're gone, and then you're like sandpaper, like this. And so it's really important that we get to the root of the problem and we do some more tests. And I need you to come back next week, okay? And I know you've got a lot going on in your life. You're probably wondering, Doc, I don't have symptoms. Why do I got to come back, right? And you're right. You don't have symptoms. Like so much of disease today is asymptomatic, heart disease, cholesterol, and so on. But I wouldn't be doing myself a service to be your doctor if I didn't have you back to look into this further and to figure out the problem and then get you treatment options that you needed. Because once your glands are gone, they're gone forever. And I don't want you, me or you to have regret. Does this make sense? Close. That's it. Close. That's it. You're done. So it's really important that you address the hesitation questions that patients have in their head out onto the table so that you can address them. That, folks, is the language of conversion for dry eyes. You've got to start with understanding the psychology of most human beings is they have very little bandwidth for complicating their life with so much stuff. So you've got to simplify, clarify, and make it just so simple that it makes sense of it. Okay? Simplify, clarify, and sense. You've got to make sense of it. All right. Let me wrap up as we're closing this session, okay? It's very important. It's very important that you remember. And I give you another quick tip here. Okay? It's called the 3 hats strategy, okay? We discussed it in a lot more detail in some of check out my YouTube videos. We really go into deep about like the language to convert and the three hats. The way to remember this as a doctor is I got to wear 3 hats. The first hat is the doctor hat, where I diagnose the condition. The second hat is the educator hat. Understand why something happened. The third hat is a mind reader hat, where you're going to read their mind and you're going to answer questions, hesitation questions, objections that they have in their head, and you're going to bring it to the table, and then you're going to proactively answer it, and then use that terminology we talked about, probably wondering, and then does this make sense to close, and then get them back for the conversation. That's the answer to getting patients back for the ocular surface evaluation, is to use the language of dry eyes and then educate them and then be a mind reader and say, look, I know you got a lot going on. I'm asking you to come back in a week for a 30-minute visit. I know it's a lot, but it's important because we found this, and that, and we think it's really important to come back. And that's it. You're done. So that's the way. So will I see you back, Mr. Jones, next week? Yes, doctor. That's what you want to hear. All right. So I'm going to stop here. I want you to do me a favor. If you found this useful and valuable, just type the letter Y. Just type the letter Y. Yeah, it was cool, Bob. Good job. Thank you for that. And if you want more content like this, for me to share with you these valuable strategies and a script of what to say, when to say it, how to say it, type the letter Y, and I will send you very, very specific video teaching you this language in more detail so that your IPLs don't just sit there and gather dust, they actually start humming. We're so committed to helping you and your practice grow. Please come just check out our stuff, check out my channel. Happy to give you more advice and strategies and tips. I hope this session was useful. Thank you so much for sharing your time with me. I hope it was valuable to you. Again, my name is Bob Miglani. I'm the founder and CEO of Hoot. We help transform practices with process, platform, and presentation, which is what we talked about today. Hopefully this was helpful. Thank you all very much. Have a great day, everybody. Thank you. Bye. Thank you.